Hello everyone. Today we have with us Dr. Shibani. She is someone who truly believes in holistic approach to wellness. She started her journey as a BNYS doctor. Over the years, she has become a trichologist helping people with their health concerns, a clinical dietitian guiding clients in their nutrition journey, and a cosmetologist working on skin treatments. She is the founder of Midas Wellness Hub, a space that brings all of these things together. I'm really excited to have her today. So welcome Shibani.
Thank you so much, Mata.
So tell me something about your journey. What inspired you to come into
So
this
my
industry?
inspiration came from a deep passion for helping people lead a balanced life. I knew true health was not about treating symptoms, but empowering and educating people on the importance of leading a healthy lifestyle and how it impacts their overall life, their well-being, and their appearance. I remember in my teens, I had a lot of acne on my face. My face was full of acne when I was like 14, 15 years. And obviously, I went to various doctors and they told me, do not touch your pimples, do not
Pick it.
pick it, do not squeeze it.
Yeah.
And I was suggested several lotions and creams. But nobody told me that there is a direct relation between your skin with your skin and your gut health. If that information was given to me that time, then I would have had little trouble. And I remember having these acnes leaving marks and scars and pits, and this really works negatively on your complete personality. It sort of gives you low self-esteem, low confidence. Your interpersonal relationship is not good, and absolutely low confidence. So I realized that, and I realized there is a lot of gap for people to understand these things. And I thought I should start something like this where information is given to people. I truly believe that external health is the result of your internal health. Your skin is the manifestation of your inner health. So it's very important that you have nutrition, in place, and lead a healthy lifestyle, and how it affects your overall being, your health, and skin and hair is always a byproduct of leading a healthy lifestyle.
Very true. How you look actually affects, the way, I mean, it is somewhere, I can say that, you carry your confidence somewhere because of the way you look also. And I
Absolutely.
can so much relate to it. Like,
Oh
I can
yes, oh
understand it.
yes. In fact, people with skin issues and skin concerns and hair-related concerns generally are seen to have low confidence. There is a peer pressure, there is uh, comparisons with friends who look better, and then there is other issues that I wouldn't want to get into, like personal relationships. So they say, if you look good, you feel good, and if you feel good, you do better in work. So somewhere your productivity in your work improves, and even in your personal life is better.
Yeah.
So it definitely has an effect on your overall being.
And I'm so happy that we have you today where you're highlighting so much about it's not just about
Yes.
the external looks but how you internally deal with your body which reflects outside.
True.
So now tell me that the beauty and the wellness industry has really grown a lot. So what trends do you see in this industry?
Oh, the beauty and the wellness industry is evolving rapidly. As a matter of fact, there is 15% growth every year as per stats. And the consumer preferences today is changing. There is a rising demand for things like fillers, Botox, which was earlier the something reserved only for the models, actors, the rich, is now available even for the common people. I have a lot of people in their 30s who are understanding the importance of these things. And the fact is that the accessibility is better. The education and the awareness as far as social media is concerned is much more. So this industry is definitely growing, and it is going to just keep growing, 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 I'm sure.
Yeah. Can you tell us some basics about skincare or some myths that or mistakes that people make during the
Oh,
skincare?
so the biggest mistakes that I have come across among girls is that they start copying somebody else's skincare, or they're influenced so much by certain models, actors, actresses, and influencers that they blindly go and buy things across the counter and start using it, and then they realize it's not meant for them, and then these products cause rashes, pigmentation, dryness. You first need to understand your skin type, and then you need to understand what kind of products is going to suit your skin instead of just randomly buying. So it's very important that you first meet a skin expert and understand your skin type. and then go ahead and using certain skincare products.
Yeah, makes sense. Yeah, this is something which even I have done before, seeing somebody and this will work on my skin.
Oh,
I would have
yes.
experimented it and
And then I
I
have
have
some people coming and telling me, oh, my
results.
friend advised this for me, and I started using it. So something that works for your friend
It's
doesn't
not
mean it's
necessary
going to be working for
working.
you.
What are the biggest skincare mistakes that people make, regardless of their gender, be it men or female? They make these mistakes and they should avoid it.
Oh, yes. So the common mistakes that people do is avoiding applying sunscreen in the rainy season. Very common mistakes. Then another thing that we normally come across is, oh, it's winter, I'm indoor, I don't need sunscreen, I don't need moisturizer. That's the biggest myth and biggest mistake that people have. They think, oh, I don't step out, so I don't need sunscreen.
Oh, but this is something which even I do. Like indoor, I don't apply
No, your
sunscreen.
sun rays can enter through the window panes. The moment the sun rises, you need to ensure that you're applying your sunscreen to give you the protection. You don't have to be actually going in the sun to apply sunscreen. And as a matter of fact, if you're somebody who travels a lot in the sun, you need to reapply again after 2 hours. So the CTM that generally people suggest, the cleansing, toning, moisturizing, is something that everyone should follow properly. I can show you some pictures that are at my clinic of certain women who have been using sunscreen for long, for many years. And there are some women who have started to use just lately. So obviously there is a delay in the one who's been using it for long. Delay of aging, delay of pigmentation, delay of fine lines on the skin.
I can understand this because even I started using sunscreen just 2 to 3 years back, trust me, at my
Oh,
age. So, of course, my pigmentation and everything, and because I'm a dry skin person, somewhere because of not using
okay,
sunscreen.
that's another thing that I come across. I come across a lot of individuals, a lot of girls with dry skin today. As young as 20s, 25. Dry skin generally happens when you turn 40, 45, when the body starts releasing less of estrogen in the body, like in your perimenopausal stage, when the skin starts to turn thin, hair starts to turn thin. But I'm seeing this very common today. Why? Because of the toxicity in the air, the quality of food that you and I eat, and on in our daily basis, the kind of stress we take, and also we have high targets to achieve.
Yeah.
We have so many things to do throughout the day that we completely ignore the small things, that is the importance of eating healthy meals and ensuring that you eat everything that the body needs. Most of the food that we have is suboptimal. It means that you're eating less than what is required by the body. So we
In terms of
always
nutrition.
nutrition plays a big role here on your skin. So people with dry skin generally have certain vitamin deficiencies like fat soluble vitamin deficiency, which is generally seen in vegetarians because they have less sources of fat soluble vitamins.
Okay.
Yes, it's very common that we see. Then in among the non-vegetarians, you have different kinds of issues. Okay, so you have the non-vegetarians also who do not lead a healthy lifestyle. Then you have some individuals who lead a very very poor lifestyle, like they eat junk food, they live on certain junk food every day, diet coke and aerated drinks, smoking and drinking, not sleeping in the nights properly. All that has an effect on the skin.
Definitely. So tell me something, how can people identify their skin type? Like it's oily, dry, combination skin.
Okay, very easy way of identifying what is your skin type is wash your face with a mild cleanser. Okay, take a tissue paper, dab the tissue paper all over your face. If that tissue paper turns blotchy or oily, it means you have oily skin. And if there is nothing that happens to the tissue paper, it's intact, just scratch your skin very gently. If there is a white line that gets formed, it means you're having dry skin. And if you're having sensitive skin, you would know by now, a skin which turns red very easily in the sun, or a skin where all the products doesn't suit, it starts getting irritated or rashy or sensitive. It means you're having sensitive skin.
Okay. It's an easy way, but
It's an easy way, and people generally with certain conditions have a reason behind it. Nutrition is a very vital role here. Nutrition plays a very vital role in the quality of your skin. People with dry skin, like I mentioned to you, have certain deficiencies. People with acne prone skin, people whose oil glands are very active, they have different issues altogether. I'm sure it's related with the kind of food that they have. See, our Indian food comprises of a lot of carb. We have carb morning, afternoon, evening, and night. A morning starts with maybe idlis, poha, bread, chapatis,
Yeah.
and in the afternoon again we have some form of rice or chapati, again a carb, and evening again we have some sandwiches, toast, curries, and in the night again we have carb. So the carb intake is very high, and if you notice our protein intake and our fat intake and our other micronutrients like your salad, all that is very less. The
Yes.
portion of your carb is very high. So all these things obviously have a negative effect on the body.
But somebody who has a sensitive skin, can that be reversed if they actually?
Oh yes, it can be reversed.
It can be reversed.
The moment you reverse your lifestyle,
Okay.
everything works for you. For example, people with sensitive skin, okay, people with red skin, people whose skin is very sensitive, they generally have poor gut health. People with IBS, people with urticaria. Urticaria means the moment you touch it starts swelling. Okay, it's super sensitive. So it is completely related to their gut health. If their gut health is poor, which means you have bloating issue, you have constipation issue, you have diarrhea episodes, okay, which means that your body is not absorbing the food that you're consuming, which means your body is not getting everything that it needs. So you first need to fix your gut.
Yes, and it will automatically then show.
Yes, there is a
better
big
results.
relationship between your gut health and your skin health. It is a complete correlation. So the moment you fix your gut, your absorption of everything that you eat happens better. And when that happens better, then everything falls in place. So your skin and your hair is actually the byproducts of living a healthy lifestyle. And that is what I want to educate most of my people. That
Yes.
when you change your lifestyle, and of course we all need to have some food which is, gives us happiness. Yes, which releases our happy hormones, like vada paos, or sandwiches, या रोड पे pani puri खा लिया. So वो चीजें भी करो. I'm not saying you don't do it, but do that in limitation. All right, like just bring some discipline in your life where you lead your life in a manner that your 6 days of the week, in a week, you follow a disciplined life, and maybe on the 7th day you break your fast and eat whatever you wish. So you do that 4 times in a month, so that you're happy, and at the same time, your diet is maintained.
Yeah, makes sense. But that discipline is difficult for people to maintain.
Yes, there is no gain without pain, isn't it? You cannot have the cake and eat it too.
Yes.
Okay, so a lot of people come and say, oh, I can't do this and I can't do that. So I tell them it's a choice you need to make. But when you turn 60 and 70, when all the diseases start surfacing because of nutritional deficiency all these years, then what do? You go to hospitals. You have no choice to sit in long queues of meeting doctors, taking medicines, and even after doing that, you don't have a full life. You don't have energy, the kind of energy that you had in your 30s. So I strongly believe that people don't die because of their old age. They die because of the disease that comes in the old age. And the disease comes because of the poor nutrition throughout their life, which they completely ignore. The skin is the largest organ in the body. Okay? I cannot see your internal organs. What I can see is your hair and your skin. And the skin is trying to tell you, okay, I need certain things. Your body needs certain things. And when you do not feed your body with all it needs, eventually culminates into different kinds of disease.
Yeah, I hope that the audience is clearly understanding that how much important it is for you to have a right nutrition. So what are the top must-have ingredients that for a good skin?
The most basic, just saying very, very basic, as important as brushing your teeth in the morning. We don't miss doing it, right? Then you do not miss, following a proper skincare in the morning before you step out. Your face wash has to be something which is going to be suiting your skin type. 2, your moisturizer and your sunscreen. And in the night, a basic routine, if you're somebody who applies a lot of makeup, or if you have traveled and come back home, because of so much of toxicity in the air, there is a lot of grime and dirt that is settled on the face. So it's important that you come back and wash your face. Okay, and then apply a moisturizer. Application of moisturizer is important because every time you wash your face, you're actually irritating the pH level of your skin.
Okay, so irrespective of dry or oily skin, person must
Oh,
apply
yeah, that's
moisturizer.
another myth that I
Yes.
completely forgot to cover here. Is a myth around application of moisturizers
For
for
oily skin.
oily skin. Oh my, I've got acne on my skin. Do I still need to apply? So oily. The moisturizer makes it more oilier. No, it is the active oil glands that you need to control and not the moisture. Your skin needs moisturizer. And especially for an oily based skin, there are different kinds of moisturizers. There are gel based moisturizers that we recommend.
So, how is skincare different for men and women? What is the difference exactly?
There is a lot of awareness today among men also. So the men grooming is trending. Holistic beauty is trending.
Mhm.
People, even the male species, are understanding the importance of having a good skin is important today because generally men are more concerned about their hair.
Yeah.
Yeah, but now the men have understood the importance of including a skincare also. Men generally travel on bikes. They're more in the sun than the
Hmm.
females. The ignorance is more again among the men. So the basic application remains the same. But again, even for the men, they need to understand their skin type.
And somewhere I feel that in the case of men, it is ignored as something that skincare is something which is more for females only, or it is just for
They think
females.
it's vain.
Yeah.
They think it's very feminine to
Aha.
follow.
And if you follow
And
skincare, then maybe somebody will think that okay, this is not something, but still he is doing it. Is this
yes,
something
I'll
wrong?
be
Huh?
made fun of.
Yeah, I'll
and
be
all.
made
Yes,
fun of
yes.
and something.
But
So,
eventually, when they realize that my skin is turning dark, then they come back. So
hmm.
all I'm telling to the men is it is very important that they also need to follow a skincare routine so that they don't fall into the zone of having pigmentation or dry skin. Men generally do not, their skin doesn't age so fast as female. Okay, their skin is thicker.
Yeah.
They have a better quality skin compared to the female actually. Yeah, we have seen that. And all that we do on the skin, like whatever treatments we do, it works better on the men because we do a lot of aggressive treatments very easily on the men, and it works really well for them. So the skincare for the men and for the females can be the same, but in both the cases, they need to know what is the skin type.
All right. So many men still use soap on their face
Oh.
today. So is soap really harmful, or still cleansers should be used by men
Oh,
too?
that's another thing among the men because of so much of ignorance, because they're always running, because of the fact that cleaning or taking care of the skin, as you said, is not for the men. They don't just care. They use anything that is lying in the bathroom, and soap is
I can
something.
so much relate. It's my brother. It's my brother who can use anything which is lying in the
Yes,
bathroom.
yes, because they are always in a hurry. They're so much into sports. They play cricket, they play football. They're mostly in the sun more than the females. So they really, really need to take care of their skin because their exposure to the sun is very high. Soap is a big no-no because it is very alkaline. Okay, it is not gentle on the skin. It is going to really rip off and strip off all the moisture from your skin. Eventually, your skin is going to become dry and pigmented. Remember, a skin which is dry gets pigmented easily
Yeah,
because
I know that.
because it lacks the soil
Yeah.
and the thickness and the ingredients that the skin needs for it to look the way it should look.
Yeah, makes sense. Definitely. Yeah, sure. Even my brother started using sunscreen off lately, like just 6 months back when he started traveling. Otherwise, he was someone who never used to do that.
Yeah, and the other thing about with the men is they smoke, they drink, and they come back late in the night. They remain awake in the night. You find the men more watching televisions late nights. All that has an impact on the face and the skin. So here again, I would like to highlight: it is not the skin and the hair; it is your health which is at stake. So when you sleep late and all of that, it has an effect on your body.
True. So yes, again, one important question which I have, like, is it safe to take supplements, and like, is that should be a part of your routine, or just the diet is
You
enough?
tell me what is the quality of food that you and I eat. Are you telling me that the food that you consume has got everything that the body needs? If yes, then why people fall sick? Why people have metabolic diseases, or they have cardiovascular problems, or they have high levels of alleles in their blood reports. So supplementation is the future for all of us. Supplementation is nothing but you are giving your body what it needs because you're not getting it from the food. For example, when you are eating food rich in iron and calcium, calcium will get absorbed, iron will not, because it is designed that way.
Okay.
Okay, so there is certain food which gets absorbed and certain things that doesn't get absorbed. And then the fact that your internal health, your GI tract, your gut health again plays a vital role here. So supplementation is important because you do not get what you need on daily basis. For example, vitamin C is so important for your body. Unfortunately, the body doesn't store vitamin C.
Hmm.
It doesn't store. Okay, so it's a water soluble vitamin. And what are the sources of vitamin C? You have citrus fruits, you have broccoli, cabbage, red yellow capsicum. Do you have that every day?
No.
No. And then what do? The only thing that you can do is take them in the form of supplementation.
So what are like the basic supplements which, let's say somebody's crossing 30 and they should have that?
It is
in
not just for the ones who cross 30.
Okay.
Supplementation is also needed for children as
Okay.
young as 5, 10, 15.
Okay.
Yes. You tell me, what is the kind of meal that is being eaten by children today? Women are so busy, the mothers, they're busy doing their own things. So they very conveniently buy a packet of chips and make the child busy. And the child is busy eating the chips or chaklis. And we say, "Nahi, bacha hai. Arey, bacha hai to chocolate de do." So the child's health is completely ignored here. And therefore, you see a lot of children having ulcers in their mouth. Okay. Now, having ulcer is a symptom of B complex deficiency. And when you have too much of carb in your body, there is a depletion of B complex. When you smoke, there is a faster depletion of vitamin C. So smokers have to have vitamin C every day.
Oh my
So
God.
collagen starts, depleting even faster in smokers. And coming back to children, my own child, he goes to the school. I take the trouble of waking up at 6 o'clock and prepare meals myself. And I ensure that even if he wants to have a vada pav, I make the vadas at home. Because I know the oil that I'm going to use is a non-rancid oil. It's a fresh oil. So once the smoke comes, the oil becomes rancid. I'm sure you know that. So there are hotels who keep reusing it.
Yes.
And the ones that you get on the street are those, why vada pavs are so cheap?
Because the oil is again and again.
It's reused.
Yeah.
They keep in those big dabbas and boxes and they store it and they reuse it. So that is how it becomes so economical for people to buy and eat it. So there are children. So I take the trouble of making these tiffin boxes, healthy ones and tasty. And then my child comes back and saying, "Mama, I ate chakli from somebody's box. I ate vadas and burgers from somebody." So I always wonder why mothers cannot take the trouble of waking up in the morning and ensuring the child is having a nutritious meal. Now, omega-3, a completely ignored supplement. Completely ignored. Your omega-6 comes from the oil that you use. All your oil. We use oil every night. So all the oil that you use has got omega-6. Now, omega-6 is what is known to give inflammation in the body, which is responsible for the inflammation in the body. And you need to have omega-3 to some extent to ensure that there is this particular ratio of omega-6 and omega-3 that you need to maintain. The body doesn't make omega-3. You need to consume it externally. So the sources for the omega-3 for the vegetarians are walnuts, almonds. The non-veg sources, the best source of omega-3 is the fish and the cod liver oil, which is really, really amazing for your skin, for your eyes, and for your brain.
Okay.
Yes, your brain is 80% fat, by the way. It's 80% fat. How do you think Alzheimer's and Parkinson happens in the old age, dementia, where people start forgetting, you have brain fog and all of that? It is all the result of having so much of carb throughout your life. So coming back to the child, the need of supplementation for the children. So I give my son omega-3, I give my son magnesium because he's a footballer. And I don't want my son to come back and tell me, "Mom," he always used to complain about pain in the leg. Because, football means you require a lot of energy. Okay, and you require that kind of fitness. And I'm seeing my younger one who used to be so hyperactive. And yeah, to some extent, I even consider him having ADHD because he had this habit of incompleting his tasks. He would, anything I would give him, he would do and then just leave it and go. Just leave everything. Then I put him in the chair side just to sort of keep his concentration level high. Then he somehow managed to do the chess class and he said, Mama, I know to play chess and all. But from the time I started to give him omega-3 and B complex and magnesium, it sort of comes because see, it's a neuromodulator, magnesium. D3 is a neuromodulator. So they're very important for the calmness, for your nerves to be calm and for your concentration to be better. Imagine you're very intelligent, but because you're not able to keep your concentration in place, you finish your tasks half and run, in your case, in your work. I'm sure people are not going to be happy, your productivity will drop. So all these things are very important. Omega-3 cannot be taken from food sources unless you're having fish every day. And we women especially, we are known, even if the fish is served, we have only 1 or 2 pieces. Oh, because we're women, we're supposed to have less of non-veg. That's what we are brought up, right? That's how we're brought up.
Okay.
All people are, all women are brought up. All women, mostly I'm talking about the women sources, the ladies in the house. If the chicken is made, if the paneer is made, they generally serve themselves little. Yeah, I've seen that.
Okay.
I've seen that. I've seen that in my own house, in my own family, South Indians. Oh, the mother is supposed to eat certain food in limitations and all that. So you tell me, where are you getting the nutrition requirement of the body? Are you fulfilling it? No. So which means that you need to supplement. And if you are somebody who's always on the go, you travel extensively, you don't have time to cook, and you're eating every day the same thing, then what? We normally have the same food every day. Like dal, sabji.
Yes.
Yeah. Sabji will change, dal remains same. Morning ka breakfast remains same. Unless you're calling something from outside, which is again unhealthy. कि मैंने Blinkit से मंगा लिया, मैंने what is the other side that you
Zepto
से मंगा लिया कि ठीक है चलो आज ये मंगा के खा लेते हैं. Oh, and we don't know how it is prepared, but since you don't have the time, so you purchase it. But then mostly we have the same food every single day, and because we consume the same food, we have certain conditions, and those conditions surface in the form of acne, under eye dark circles, hair thinning, dandruff, very common condition, zinc deficiency. Dandruff is zinc deficiency, period. Your zinc sources are the best in the non-veg. Of course, there are in vegetarian sources also. You have your, those seeds, the sunflower seeds and the pumpkin seeds and the flax seeds. Again, who takes them? So, but if you bring certain discipline and design your diet in a manner that every morning I will have this, and take these 3 supplements, and dopair mein aake I will do this, life is sorted.
Yeah, makes sense. But you know what I personally feel is there's a myth about supplements with people. You're taking supplements because तुम्हें deficiency या फिर तुम ठीक नहीं हो इसलिए तुम supplement. But you know that it is actually a precautionary measure that we are taking for future. What is the most irritating thing? This is something which my sister also told me today because I take supplements and she's like, ना पहले गोलियां खाना बंद कर, just stop the supplements. But I have started it and I am still. She being educated, I being educated, I'm not able to convince her that, why it is.
Exactly. Good. So that's a big gap.
Yeah.
People love to take medicines. They don't mind. This is conveniently come telling me, they tell me, oh, I'm taking hypothyroid medicines from so long. Well, any meds are your own? Okay, hypothyroid. Anything else? Hypertension med. Hello, hypertension medicines. They are medicines. They are medicines. Proper medicines which has certain implications if you're taking it for a very long time. Okay, they are beta blockers, calcium blockers. They come in different kinds of forms. But they have their implications. They have their downside. Supplements do not have any side effects. Excess of supplement is bad.
Yeah.
For which I always say, do your blood test once in 6 months to ensure that everything is going great for you. And if there is any symptoms, like I do weight training, okay, and I've been doing weight training from so long before my marriage. But I don't have any bone pain, I don't have any joint pain, I don't have any back pain. आप sugar ज़्यादा खा रहे हो, sugar का मतलब crystal white sugar नहीं. तुम्हारे जो carb हैं, simple carb हैं.
That also get processed at the end into sugar only.
Exactly, they get converted into sugar. Yeah. So the consumption is high. expenditure is less.
Hmm.
तो क्या होगा? Body will turn that into fat and you will have fat accumulation, mainly on the abdomen.
Yeah.
So it all gets converted into fat in the adipose tissue and they start getting stored in your
Lower
abdomen.
yeah.
Abdomen.
So how can women, solve the issue of hormonal acne, because it has been very common?
Yes. So hormonal acne happens mainly, as the name suggests, because of the hormones. There is a huge fluctuations of hormone in a female body, right from menarche till menopause. जब periods चालू होते हैं और खत्म होने तक, there is a roller coaster ride of, we have our mood swings,
Yes.
estrogen, progesterone, ऊपर नीचे. So the main cause for menopausal acne is high levels of androgens in the body. And high levels of androgen होने का कारण ये है कि stress could be one of the things. So in the perimenopausal stage and menopausal stage, you normally find women having acne. You also find acne in PCOD. People having PCOD, people having certain hormonal conditions because of which they also have acne. And the main reason again is high levels of androgen. High levels of insulin, which means high levels of sugar intake, will eventually convert into high levels of androgen. And they convert into acne. In simple language, I'm saying.
So how can it be stopped? Just by avoiding sugar?
If you want to control your acne, control your eating habits. You might be somebody whose eating habits would be high levels of sugar, dairy products, carb intake is very high, junk food is very high, you're having poor gut, I'm sure you'll be having constipation issue, or you'll be metabolism is slow because of hypothyroid. So all these things obviously will culminate. High levels of androgen is one of the main causes for hormonal acne, which I've seen in PCOD patients.
Okay. So I hope women take a note of it and they get the root cause and understand that they can solve it by this way.
No, you tell me, girls with PCOD, when they go to certain doctors to fix it, there is cyst in the ovaries, right?
Yeah.
Polycystic ovarian disease, okay, is what is the terminology, the full form of PCOD. They are recommended birth control pills, okay? So they don't get your periods every month. So sometimes they get it like once in 2 months. And there are some who get it every month and still have acne. Okay, and there are certain...
Now there is facial hair also sometimes.
Yes,
I feel that it's
high levels of androgen, which is a male hormone. The men normally get hair here, so it's a male hormone. So when the androgen levels are very high, so the men generally have hair. We are not supposed to have hair. We are supposed to have high levels of estrogens and less of androgen. When it is the other way around, you have these kind of issues. So there are certain supplements we recommend even for PCOD. Okay, to bring down this condition.
Okay.
Like cruciferous vegetables is considered to be very, very anti-androgenic.
Okay.
Yeah.
And to be had regularly.
Yeah, because it comes in pill form that I recommend.
Okay.
So it works wonderfully well for such a condition, other than improving your lifestyle.
So what are some of the most common hair concerns and how can they be addressed? Like maybe the dandruff, hair fall issue is there, white hair, grey hair, which people
early
get.
graying.
Early graying. So how can that be addressed?
So like I mentioned to you, all boils down to nutritional deficiencies. People who suffer from early graying are people who are having deficiencies of copper. It's so important. Copper, B12, folic. They have less of these in their meals. Okay, maybe they're leading a very stressful life. Maybe they're those individuals who don't sleep well. Maybe they're those who smoke. Okay, and they lead a very stressful life, or they're not having a very healthy lifestyle. Are those kind of people who generally have early graying. So early graying are even seen in children today. Like I mentioned to you, nutrition is completely ignored for children. The biggest joke is people say, why are you feeding so much of protein to a child? A growing child requires more protein than you and I, because the body is growing. And protein is important for growth. It is very, very important for growth, maintenance, and for various factors in the body. So those are things which are very, very important, which is completely ignored. And when it comes to nutrition among people with hair problems, like I mentioned to you, if there is nutrition deficiencies, it is going to manifest in different ways in different individuals. Some people may experience hair thinning and hair fall. These are all symptoms. The moment you see your hair is brittle, your nails are breaking easily, these are all symptoms of certain deficiencies that is going on inside.
So anybody who has gray hair or something, it can never be reversed by supplements.
It can be reversed by making nutrition changes, food changes, lifestyle changes. But you cannot reverse somebody who's already of an age and aging वाला जो hair gray है. मगर जो hair graying जल्दी होता है, those obviously can be reversed 100%.
So are Botox, fillers, and some laser treatments like really good, or they are there for reversing your aging? Like, it is something which are just the golden words which we hear in the market.
So fillers and laser treatments and Botox treatments are wonderful treatments. It depends on each individual to avail it or not. It is all available. Okay, and they're absolutely safe to be used. They do wonders for people who are looking for quick fixes or want to look younger, who want to erase fine lines. Fillers work wonderfully well for people who have these hollowness that appear on the face as you age.
Yeah.
Okay, you'll typically see that hollowness appearing on the face in certain areas. So it gives you a wonderful result. But again, it depends on an individual. There are some people who don't like to avail it. For them, we have certain other procedures like skin booster injections. The word skin booster means it is boosting the skin. It improves collagen. It improves elasticity. It delays aging. And the beautiful thing about skin booster injections are it can be injected under the eyes. It can be even injected here. Yeah, it can be injected here.
Okay.
In your decollete area. It can be injected anywhere. For example, if somebody who's in the 30s, the skin is not aged yet. Okay?
Yes.
But there is an onset of fine lines that have begun to appear. You can do skin booster injection to reverse it. Okay. But I don't see that as a major concern. Like I said, it all depends on individuals. There are some people who want to look the best and they don't mind spending time and effort and money for it. So Botox and fillers is something that is available. It's very easily accessible today, even for normal people. Earlier, for the people who were living in the earlier times, like in their, I'm talking about the olden days, like old actresses don't use it. I'm talking about those really pretty actresses of like 60s, 1960s. They've aged very gracefully. This is what they say. For individuals who haven't used the Botox and fillers, she's aging very gracefully. So it all depends on individual to individual. It's if you are accepting your face the way it is, okay, and you're accepting the aging gracefully, you don't do it. But it is available and it gives you a wonderful result.
So how does the pricing? Because I think normally the myth is there even about it's very expensive, so I couldn't get it, or cosmetology is very expensive. But how does the pricing vary?
Now see, there is a big myth and less education, less information about this. People think Botox hai, they come to me and they say, I don't want to do injectables. I don't want any bleeding. I don't want any injectables. So, we need to explain to them that there are these advantages. As far as the rates are concerned, the pricing is concerned, it's much better priced today, like I said, because the demand has risen. Demand has risen, availability is better. There are many, many options. There are many, many new companies coming in India where fillers are easily available at a much better cost than what it was available at a very high cost. Like earlier, Nokia phones were so expensive. And now it is so, economical. So they're all there and they're very fairly priced.
So what does an air conditioner does to your skin? Because we are in the AC.
Yes, that is something that we cannot live without.
Yes.
And the kind of summer that we go through, it's crazy.
I think in 12 hours we have summer only because we see winter hardly for 2 months or something rainy.
I know, I just love the winters. Oh yes. So the AC is one of the worst things for your skin. It strips you of moisture. First of all, AC removes moisture from the air. It makes your skin dry, flaky, irritated. As a matter of fact, if you are having sensitive skin, acne-prone skin, and your skin is already dry, it is going to worsen it because it disrupts the skin's barrier.
Okay.
So there are certain things that I normally recommend. Keep a humidifier in the room. Humidifier brings the moisture back in the air. So it
Okay.
does wonders to your skin. One, it's very economical. You can store it in your room wherever you're sitting in. Two, use a very hydrating serum, non-comedogenic moisturizers, very hydrating. You can also use these amazing thermal sprays and mists, like rose water mist you get. That really retains the hydration on your face. And start consuming fat soluble vitamins.
Okay.
And again, try to find out why your skin is dry.
Yes.
So if your skin is sensitive and dry, reverse it and check what all things that you're doing throughout the day and start taking the supplementation because to fulfill the nutrition requirement.
Yes, yes. No, I can relate to it. Okay, it's so much important. So, yeah. Okay, so in terms of busy professionals and working women out there, so how can they adopt a holistic skincare approach, especially somebody who is just traveling on and off train
Yeah.
and continuous traveling, job, somebody who is into sales. So for
Yeah.
busy
So
professionals.
I come across a lot of these women who tell me, some women who say, oh, I don't have the time. I don't have the time to take so many supplements. I don't have the time to apply so many things. Oh, there are so many things I need to apply. So my question is, then don't apply. Then if you don't apply and don't follow it, you will not reap the benefits. There is no gain without pain.
Yes.
Okay. So if you can take the trouble of sitting on the mobile phone at times when you don't need to, I'm sure you can remove 10 minutes of your time and vigorously, religiously, diligently follow everything properly.
Yeah.
Just 3-4 products is what I normally recommend. Even for the ones who are always on the go, people who are frequent travelers, they need to carry them in a very systematic manner, store it and carry it and apply it wherever they go.
Okay.
So the basic face wash, moisturizer and sunscreen is a golden rule here. And invest in good moisturizers. The beauty industry is expanded so beautifully now that for people with dry skin, they have ceramide rich hydrating moisturizers, especially for aging and matured skin. There are some amazing products available in the market today. So if if you really can and if you really want to fix things, then you must ensure that you follow them properly.
Got it. Now, this random question came to my mind that how are this sheet mask effective, or are they even effective? Like, because there are a lot of now Hydra facial, there are normal facial, Hydra facial. Now, sheet mask is also like very trending in the market. So, are they really effective in?
So see, I'll tell you, they're all effective.
Okay.
As long as you're having a good healthy skin.
Okay, everything.
So तुम्हारा skin already बढ़िया है, उसके ऊपर से तुमने ये डाल दिया,
तो और बढ़िया होगा,
और अच्छा होगा, ग्लो आ जाएगा इन उधर. मगर अगर तुम्हारे स्किन पे ऑलरेडी इश्यूज हैं, you are having dry skin and you are having perioral darkening and you are having pigmentation and melasma on your face, you think the sheet mask is going to reverse it? Definitely not. So you first, like I said, if the skin needs if it has got certain condition, some serious condition, then you need to fix that. And then with the sheet mask, it will work wonders on your skin. But of course, the sheet mask will improve the quality of your skin if you use it maybe once in a week, along with the other skincare. With individuals who have got pigmentation on the face, girls and men both, melasma, you will notice these are those women who haven't taken care of the skin properly. Do you agree?
I do.
They haven't. They've ignored it. So when a girl grows up, okay, there is certain product that she should start using to maintain that skin that she has in her teens, in the 20s. But what we do, 20s में बढ़िया लग रहा है, मस्त लग रहा है, everything is great, hair is thick, lustrous, face is glowing. So you just apply some products and run out. And then eventually, because your exposure to the sun is so high, because your lifestyle is not good, eventually 30s may start showing certain fine lines.
I would like to highlight here that somewhere it is, the parents also, where they say कि नहीं कुछ भी मत लगाओ face पे, and because ऐसे ही अच्छा लगेगा, कुछ reaction हो जाएगा या something. Because I know my mom used to say me this when and otherwise apply that haldi ka paste or something. How effective are these DIY remedies when you apply lemon on your face or some tomato?
See, I'll tell you,
rubbing.
some DIY does, it really works for you. Like People who are having dry skin, if they're using aloe vera gel along with vitamin E, those capsules, you break it open and it works for you. It helps in hydration and all that. In fact, even yogurt on your face, it's got lactic acid. People who are having dry skin, they can use it. Okay, the sugarless one. Okay, the completely organic epigamia yogurt. You can use it on your face. It's because it's got lactic acid and it is very good for dry skin. But the DIY and your question initially, what you asked me, that the parents refusing, that's absolutely a no. I mean, because I have a lot of people who come and tell me, oh, I haven't used anything on my face ever. You know why? Because if I use something, it reacts. You're not using anything because your skin is sensitive. And your skin is sensitive because then I ask them, well, how is your gut health? How is your lifestyle? Do you drink enough water? How is your sleep pattern? Okay, how is the quality of sleep? And what is the kind of meds you take? So people who are having sensitive skin, red skin, generally have issues with their gut, generally have problems. They are on certain kind of medicines because of which the skin behaves in a certain manner. Having sensitive skin is not good. Your skin turning red is not good. Don't be happy. There are some people who say, oh, my skin turns red.
Pink. It's pink, not red. But then.
Pink. Yeah, they think it's pink. They think, oh, it turns red. And then I tell them this redness will eventually turn black because the skin doesn't have the moisture to hold. It doesn't have that soil, as we say. So you need to improve the quality of your skin to ensure that the skin doesn't turn sensitive. It is not supposed to turn red unless and until you're very, very fair. That is okay. That's a different thing. Then you come back to your normal skin. But I'm talking typically of an Asian skin.
What is your take on the collagen supplements which are there, the peptides, retinol, which is, even promoted by a lot of influencers out in the market. So
there is a lot of myths and different opinion about different people about collagen. They say collagen doesn't work. I'll give you my example. Okay. Firstly, your body's protein is almost 30% made of collagen. Collagen is just not needed on your skin, on your hair, for your hair. It is needed for your bones. It is needed for your lungs. It's needed for your gut lining. So for your ligaments. So I take my collagen powders and I don't have any ligament pain. I don't have any tendon pain. Women of my age suffer from all of that. Okay, which means collagen works. So if the collagen is working for your tendons and ligaments and your joint pain, it definitely must be working for your skin. So according to me, collagen supplements does wonders. People who have dry skin generally have less of collagen protein in the body. Okay. So collagen and what else? Peptides are extremely good, and retinol helps the skin improve the skin turnover.
So what is the ideal age when people should start with this?
I think the ideal age is from the age of 25. They can start. They can begin with the bare minimum percentage and see how the skin looks. And instead of using it every day, they should first do a patch test. Okay, and then use it for 3 days in the week and see how they feel, and then start using it more often.
Okay. Collagen, though, they are just supplements of powder which they can take it every day.
There are powder forms, there are liquid form, there are tablet form. I prefer the powder form or the liquid form better over the tablet form.
Okay.
I find the absorption of these two much more higher than the tablet. I prefer it that way.
And what is the ideal time to have it? Morning, evening?
See, I'll tell you, because we are so busy and we are not somebody who's sitting in the house and वेले बैठे हैं तो कभी भी खा लिया. So morning में उठो, आप अपना मस्त एक drink बनाओ, power drink. In that power drink, you put everything in it.
So give me the recipe of power drink.
Oh, so you can put your collagen powder in it firstly. You can put a nice vitamin C. You can put your glycine in it, something made of glycine. And you can put your zinc drops in it. Okay. And you make this drink and have it in the morning first thing. You can even put some greens in it if you want.
Okay.
Okay. So I have this wheatgrass juice powder. Along with that, I add this and I drink it. On empty stomach.
Wheatgrass?
It's wheatgrass.
Okay.
to get my need of, the greens daily basis.
How effective are chemical peels for pigmentation? Particularly, I'll ask you, somebody who has pigmentation around the lip area,
Yes,
how
yes.
effective are chemical peels specifically for those areas?
So the chemical people are very happy doing chemical peels, by the way. The whole world.
Even I am very happy
Yeah,
doing
yeah.
it.
They say chemical peel karo aap bindas, baki kuch mat karo. So of course the chemical peels works. There are different kinds of peels. There is AHA peel, BHA peel. BHA peel is typically meant for acne prone skin. So we have different kinds of peels for different kinds of skin condition. But if you're asking me particularly for pigmentation, chemical peel alone is not going to work. So it is a combination of skincare and different treatments that we suggest. And one of them is chemical peel. But you must do other treatments also for this condition so that every treatment brings different kinds of benefits to the table. Chemical peel will help you to some extent, but there are other treatments that is going to bring different kinds of benefits to you. Okay, like PRP, like you have mesotherapy, then you have something called dermarola, then you have something called microneedling radiofrequency, then you have laser treatments. They all break melanin production, especially laser. So all these things will help you and bring different benefits. And along with this, when you do your skincare properly and you follow a particular kind of a diet, you will see that your skin is changed completely for the better.
Yeah.
And from there, you just retain it.
Yeah. And yes, serums. Serum, I guess this is also something post-COVID got a lot of, hype in the market, like hyaluronic acid serum and this serum and that serum, because some serums are there which even I use. So are there any serums which should be used particularly by different skin type people, and any serums which should not be paired together?
Oh yes, there are certain serums that I do not recommend to be paired together. Vitamin C with retinol. Vitamin C application ke liye your skin has to be is acidic in nature. So I advise vitamin C to be used in the morning.
Okay.
And retinol is a little alkaline, it's a little less acidic compared to vitamin C. So retinol obviously has to be used in the night. Retinol cannot be paired with benzoyl peroxide because they cancel each other. There will be no effectiveness.
Okay.
And retinol definitely cannot be paired with any AHA, BHA, which is very commonly used by a lot of girls at home. Okay, that again is going to cause more irritation and cause rashes and redness and all of that. It is not recommended.
Okay. So, but serums do work.
So, if you are using any active serums, it is very, very important that you use some hydrating serums along with it, like hyaluronic peptides. If you combine these with the retinol, for example, if you're using retinol in the night, ensure that you're using some hydrating product before using any retinol products.
And what are the maximum number of serums which people should go for and not experiment with many more serums?
Yeah, this market is opened up so much, and there are so many serums.
So much. Today I'll see copper peptide serum somewhere. Trust me, on Instagram I can see so many brands selling it. It becomes so difficult to buy from one. And whether you should even buy is a question.
That's where you need the expert opinion. So you meet the expert, they advise you. So it's very important for all the girls to meet the expert at least once, and don't do all DIY and isne kiya, I like this influencer, chalo karte. Do not, it's very risky. It can be very damaging because it can lead to hyperpigmentation, and hyperpigmentation is very difficult to get rid of.
So some best foods which you will suggest for a youthful glowing skin?
Yeah. So the food, ensure that you have food rich in antioxidants. You know what are antioxidants? People advise khana antioxidants zyada khao, It's nothing but our body goes through something called oxidative stress. Okay, it happens. It is there, a part of our reactions in our body. So when that is too much, it gives birth to something called inflammation. And inflammation is one of the causes for diseases. For example, if the inflammation in your body is so much that your digestion is not happening proper, the inflammation cause could be because of the chapatis, the wheat that you're having, because it's got gluten. Gluten is something that causes a lot of inflammation in a lot of individuals. When this is not rectified, it eventually culminates into different kinds of problems. So have food rich in antioxidants to negate the oxidation that is happening. Opposite of oxidation is antioxidation. That is how the antioxidants have, are advised. So there are a lot of antioxidants which I normally recommend in the form of supplementation. But even with that, you need to ensure that your meal has to be healthy, like the greens, colorful vegetables, these red, yellow capsicum, broccoli, then kale. These are something that you must incorporate in your food other than your protein.
What is the basic amount of protein which people must consume during a
Yeah,
day?
and now again, there is a mixed information about this. I see a lot of people talking about, oh, do not consume too much of protein, you'll have calcium problem.
Or protein is not easily digestible is also what I have heard people saying.
Agreed. Which means everything boils down to your gut health. Protein is the most important macronutrient in your food. What you see today, the you and I, is protein, nitrogen. It is the protein that gives the body the shape. So when you consume less protein, what are the symptoms? Skin will be dry, hair will be brittle, broken nails, um, osteopenia, bone pain, okay, stunted growth in children, muscle loss. You see a lot of old people stooping like that and walking.
Yes.
Why is that? There's something called sarcopenia, which happens because of skeletal muscle loss. The old people also need enough of protein. Now, what happens as we age, especially in your 60s and 70s, we don't eat much. We don't eat much. We somehow start eating toast, kharis, and biscuits. They like all that. They like the carb. They cannot because they cannot chew because of the dental problem. And there is no need. They don't like it. So what is the solution for them? एक तो उनका बोन वीक हो जाता है, ओके, बोन तो उनका वीक ही है, उसके ऊपर जो मसल अटैच्ड है बोन के ऊपर वो भी नहीं है, तो क्या होगा? They die because of, they slip and fall in the bathroom, they have fractures. You've seen that very common among old people. Protein is the life giving, macronutrient among all of them. Of course, your carb and the other things are important, but protein is very, very important. At least 1 gram of protein per kg of your weight, minimum.
Okay.
If you're an athlete and if you're a growing child, of course, you need more. So, are you getting enough of protein in your meals? I don't think so.
Even I agree that
is your hair growing properly? Is your hair growing long enough? Is your hair brittle? Does it break fast? Is it very thin? Is it thinning? Are your nails breaking very easily? These are all symptoms of
low protein.
Yeah. And then eventually, when the protein is less in the body, it culminates into different kinds of problems later on. Definitely. So protein has to be even भूख ज़्यादा लगती है, protein खाना, protein नहीं है तो people eat a lot. Protein gives you satiety, fullness.
Yes. I agree to this.
And there are protein powders that people don't recommend. As far as breaking down of protein is concerned, the molecules, it breaks into amino acids in the body. So the gut health has to be really good for it to be able to digest properly. So again, you go back and check if you're somebody who experiences bloating after having protein, it means you're having some problem with your gut. So you need to first fix that. And if you're still having issues breaking down protein even after fixing your gut health, why don't you go for hydrolyzed protein, the broken form? See, you cannot chew on so much of meat and paneer and to meet your nutrition requirement. If you're always on the go, tell me, people say have protein in the form of food. Food sources say here protein intake complete karo. Agreed, I like it. But the protein requirement is about 60, 70, 80 grams per day. You and I lead a very active lifestyle. We're not somebody who's sitting in the house and watching TV. We need to move around. So you need that strength, that energy and all of that, which protein gives you. So are you fulfilling the need? And if you are, how much of protein sources of, is there in the meal that you consume? And is it enough? Like 100 grams of chicken will convert into 20 grams of protein. And 1 scoop of protein will give you 23 grams of protein. So you need to have and be mindful of it. Of course, you have this, बाकी का चिल्लर जहाँ से निकल आता है, एक थोड़ा दाल खा लिया, थोड़े grams पे. But again, the bioavailability and the quality of protein is a big question mark. People say, oh, I'm having my dal, and I'm having my grams, I'm having my chanas. I do not agree that it is a good quality protein. The protein amino acids, the essential and non-essential, and I will have to explain this to you a bit in
Yeah, sure.
detail. There is something called non-essential which your body makes, okay, and there is something called essential which you need to consume from outside. And there are 9 amino acids. If one of the amino acid is incomplete, the chain doesn't complete, which means the bioavailability of protein that you have has to be proper for the chain to complete inside your body.
So tell me, protein, you wanted to speak for a minute.
Yeah, so the protein is very, very important. It is the most neglected thing, and there's a lot of myth around it where people say, oh, too much of protein is not good, it is going to be bad for your kidney, it's going to be bad for. Yes, it is going to be bad for your kidney if you don't drink enough water. One. Two, people who are already having kidney problems shouldn't be having enough too much of protein. So that obviously has to be done under the jurisdiction of a proper doctor. But protein per se, very, very important. Guys, please include protein in your diet and be mindful when you're sitting in front of your plate. Check how much is the protein. हमारा खाना इतना होता है चपाती.
And
When
the
you're
fiber
hungry.
is also not there enough.
Exactly.
Yeah.
So do reverse. Eat your fiber, eat your protein, and then maybe have your dal rice.
Yeah.
That way, you will end up eating less carb.
Yes, exactly. So I feel actually just like every family needs to have one doctor, one CA, one lawyer. I think they need to have a wellness expert as well. I think it's
Absolutely.
now become a mandate.
Absolutely.
Seeing the lifestyle that people are following, the stress level that people have, and the imbalance which is somewhere there. So I think a wellness
Yeah,
doctor
stress is another
recommended.
thing. People not sleeping in the night, there's another problem altogether.
Yeah.
That is a different problem altogether.
Makes sense. Tell me something. I have heard a lot about this Korean skincare, the Korean products also. There is a lot of hype. So
I think it's a hype.
it's
Yeah, the Korean, it is just a selling and the marketing gimmick. Have you seen the Korean skin? Have you seen the food they eat? Their food doesn't have any spice.
I've
They
seen.
didn't. I was there once and I literally puked when I saw one girl eating candy and I thought she's having candy. She was actually having a meatball stuck in that stick, which had nothing in it.
Okay.
Yeah. So their skin is different. They have glass. They're born with good skin. Okay. So the Korean, because we look at them and we think, wow, the
It
Koreans
is because of the skincare, but no, it is more of the food that they are having.
food and their
and
genetics,
their
and they're
genetics,
born.
yeah.
They're born like that.
Got
So there is a lot of gimmick around it. I feel it's a marketing gimmick. I feel.
Okay. Okay. And is salon treatment recommended for hair fall, or does it even work?
See, now, firstly, when you have hair fall, you need to understand and see what is the kind of hair fall you have. So when you're having a hair fallen on the floor or anywhere, pick it up and see if it has got a bulb. If it has a bulb, it is falling from the root. If it's a broken hair, it is a shaft problem. So if it is a shaft problem, then there are some wonderful salon treatments that you can do, which even I avail. But if you're having hair fall per se from the root, salon treatments don't work.
Okay.
How can it work? It's falling from the root. You need to fix. It's a medical condition. There are certain deficiencies that you need to fulfill and fix. And you will notice, like people take a lot of tablets on their own, like a lot of supplements. They go and take Folly hair and biotin and all of that. Hair is just not made of
And there's some
biotin.
gummies also which are available.
Biotin
nowadays,
gummies and
yes.
all that. So see, hair is just not made of biotin. It is made of protein. It is made of collagen. It is made of zinc, selenium, copper. There are a lot of things it needs. So you need a combo of everything
Okay.
for it to be thick and growing.
Makes sense. Tell me something. See, stress is something which I feel is common. Everybody, okay? I mean, जो बच्चा 10th standard में होगा उसको भी stress होगा versus somebody who is 45 years old उसको भी stress होगा. So one or two things which you would recommend to anybody who can calm their stress, who can at least reduce their stress.
Yeah, like you
to some
said,
extent.
I can't tell somebody don't take stress. Stress is
Yes,
something
you
which is very
cannot.
common.
It cannot be avoided at any cost.
And with all the work that's going on the road, there's another stress that is new added stress.
Yes.
I agree. See, people who are very busy, okay, they're always on the go. I'm sure they have a desk in their office. Okay. So I always advise my clients, start stocking certain things on your desk and be mindful of it. कि अगर तुम चाय पी रहे हो तो have green tea. So keep your green teas there. Keep a glass of protein shake there. So in case you miss your meal, Instead of having something from outside, have a glass of protein shake. So unless and until you don't start stocking these things, we'll see little improvement. And as far as controlling your stress is concerned, you can keep these amazing, green teas. Like you have ashwagandha green tea, you have chamomile green tea. You have so many of these wonderful green teas that are available right now that you can start using. And you can start stocking them in your office and start having them to keep your stress under control. In fact, magnesium glycinate should be something that every individual should start having but just before sleeping to improve the quality of sleep. So all these things,
I can say I just had it yesterday, honestly, because day before was something which I purchased it, and yesterday only I had it. And trust me, I can say that I had got a sound dream. No doubt I had vitamin D deficiency only, which was pointed out, and I started taking tabs for that. But yes, I can see that yesterday versus today, even in a day's time, I can see a difference. And of course, the ashwagandha tea also, I take it of Vadam, but it was again recommended because that has good, the ashwagandha and something. But yes, even this is something
see,
good tea.
the beauty of the wellness industry today is there's so much awareness, and there is so much of such things available in the market versus what it was earlier.
Yes.
It's all available. You just need to take the trouble of going and purchasing them and stocking them and changing your mindset. कि मुझे अभी नींद आ रही है, people normally say एक कप कॉफी दे देना, okay? या मैं रात को बराबर सोया नहीं, इसके वजह से मुझे नींद आ रही है, I'm not able to work properly. Okay, coffee to some extent is fine, but when your stress levels are high, don't go for a smoke. People generally smoke, to sort of take care of their stress. So instead of doing that, start having green teas, start having ashwagandha tea, start improving the quality of your sleep.
Or even do workout, I feel, somewhere. I mean, imbibe some sort of physical activity also.
Yes, see, like I'm always say, when you say good lifestyle, change your lifestyle. It means include exercising, include healthy eating, go for walks early in the morning. These are something that everyone should include in their lifestyle. If you want to grow rich, if you want to look better, if you want to improve productivity in your office and have a healthy life and live long for your children. And live long का मतलब ये नहीं कि बस live long. Live a good, healthy life where your energy levels are the same as it is today. Where you're able to lift things and dance and move around and go on holidays and look the best. Then obviously you need to invest in these kind of things. And going for walks and exercise is the least you can do. Exercise improves mobility. Exercise improves the quality of your skin. It de-stresses you. It also removes the toxins from you when you sweat. Okay, it improves muscle strength. It gives you strength, energy. It makes you look better. It improves your confidence. It makes you walk upright. So there are a lot of advantages in exercising. And of course, what kind of exercise is a big question here.
For that also, then you must consult a proper person. Again, nothing should be DIY when it is related
exactly.
to your,
so what happens as a wellness doctor, I always recommend people to do weight training. Weight training is not just meant for men. Again, there is a big myth around this. Weight training work does wonders for females, especially menopausal women, on their hips, for their hip joint, for their legs, and it gives you strength. Nothing can be replaced with weight training. People do Zumba, and I joined this Zumba class a few months back, and I did it because I thought, I'm bored. But I never stopped doing weights. So instead of the cardio days, I said, let me do Zumba. It's something different. So every time I'm seeing these women, they're dancing and they all look the same on the 1st of the month. And they look the same on the 31st of the month. And they look the same at the end of the year. So nothing changes in Zumba. Zumba is a complete waste of time according to me. And the worst thing is Zumba is very bad for your knees. Okay, it is very, very bad. All that tapping and hitting your legs on the floor eventually irritates the knee. The knee is only so much, and it's holding a big entire body. Have mercy on it. So when you're doing these Zumba exercises, they're not giving you any benefits. Guys, please stop doing Zumba. If you're doing Zumba, do Zumba for dancing purposes, for fun purposes. But if you think you're going to lose weight with Zumba, no. And what about the weight loss that people do? People lose weight in such a wrong manner. They come and tell me, they say, I have lost weight. So when I look at them, I say, you haven't lost weight, you've lost your muscles.
Yeah, actually, there's a lot of difference in muscle loss and the fat loss.
I don't want to name certain celebrities lately who've been on certain Ozempic drugs, and they look really different.
Sure.
They look different because there is muscle loss, there is collagen loss, there is protein loss. Dangerous. Very, very dangerous way of losing weight. What you don't need is a fat. You need the muscle. So to ensure that the muscles are retained, you must do weight training and you must do proper supplementation of protein.
Got it. Sure. Take it. So I have some rapid fire questions for you again. So what is the most underrated skincare ingredient?
Underrated. I would say moisturizer.
Okay.
It's underrated. People just say moisturizer laga de. It's very underrated. There's another product I recently came across called arginine. Okay, people like us who are in their 40s, and when they have their fine lines and all that beginning to appear, it works like a Botox without injectables.
Okay.
It's beautiful. So it is one product, according to me, which is completely underrated. It's called arginine.
Okay.
Okay, it's wonderful.
What's the worst skincare mistake people make in their 20s?
Scrubbing.
AHA,
BHA use karte bindas. Okay, they do it at home. And there are videos कि ऐसे लगा लो, इसको mix करो, ऐसे करो. पर वो जो बोल रही है उसको ये नहीं पता इसका skin कैसा है. और वो जो लगा रही है उसको skin पता नहीं है कैसा है. And because she's loved it, she's loved the effect of it the first time she did it. So she is greedy to do it again. So they do it very often, irritating the pH level, thus causing rashes, redness, and all sorts of problems. So common mistakes is AHA, BHA, exfoliation, random, often exfoliation. And these are the common mistakes that I see.
If you had to choose between skincare and hair care, what you would choose?
I can't do without both. I need both of them. I mean, I need both. In skincare, there are certain skincare products that I use, and I keep changing them, often. Like, aaj ye laga liya, aaj wo laga liya. I'm a moisturizer crazy person. So I have about 3-4 different kinds of moisturizers, and they're really good. They're very hydrating. They do wonders to the skin. And then as far as the hair care is concerned, for hair care per se, there is this particular kind of shampoo, conditioner, and supplementation that I always ensure that I take on time.
Oh, good. One product every man and woman should use daily.
On their skin?
Yes.
According to me, CTM, I mean the
cleansing, toning,
moisturizer, and some routine to be followed on night basis also.
Okay. Most overrated skincare treatment.
The Korean glass facial that you told me.
Okay.
It's really overrated. Okay. And I think to some extent hyaluronic also. HA. Of course, it is good, but I think somewhere it is also really overrated. But Korean glass facial, for sure.
Very overrated.
Very overrated.
Okay. Challenges and the opportunities of a wellness center.
Oh, the challenges are many. To explain to people the importance of supplementation is one of the biggest challenges we've come across. They think that medication is okay to take, and they take it diligently, properly. Okay, and when you tell them to take supplementation, they think, yaar, ye bahut sare, isme kya hoga? So that is something to explain to them the benefits and how it's going to improve their condition. That is very challenging. The second challenge is to explain to them the benefits of certain treatments like PRP and needle treatment and skin boosters. They don't look at it as an essential thing. They look at it as a luxury thing. They think it is going to be expensive. They think it is going to be invasive. It is going to harm my skin. My skin is going to start looking like, they take some names of certain celebrities. So then I have to explain to them, these are not injectables, these are treatments which is going to benefit your skin, because the more trauma you create on the skin, when there is bleeding, there is more collagen that is produced, and that's how you have anti-aging benefits. There's more collagen, more elasticity, so skin looks better. So then they understand, but there is a lot of
because I think the conditioning
challenge
has been done in a way where डॉक्टर के पास जाकर आप मेडिसिन लो इज ओके बिकॉज आप बीमार हो और आप जा रहे हो, बट किसी वेलनेस डॉक्टर के पास आप जाकर प्रिकॉशनरी मेडिसिन लो सो दैट आप वहां स्टेज तक पहुंचे नहीं, वो कंडीशनिंग हुई नहीं.
Exactly. The thing is, you know what? See, please understand. We have been brought up in a certain manner. We saw our father take medicines. He saw his father take medicines, and they accepted it. Acha, he's unwell.
ठीक है.
ठीक है. It's perfectly fine. He's old. He's taking medicine. अच्छा old है, he's bald. Okay, old है तो चश्मा है. So it's an acceptable fact कि these are things that happens. So for people to understand, the benefits of supplementation and how it can reverse all these conditions, okay, that people normally suffer from, metabolic disorders like cardiovascular disease, diabetes, non-communicable diseases. There are many. Okay, so how, when we tell them this, when we start consuming certain supplements and how it is going to reverse them, that is something that is very, very difficult for them to understand and break it. They're too lazy. They don't want to give up on their cakes and pastries.
Yeah,
they don't want to give up on their breads. Now there are such wonderful options available. You have amazing options even for bread now.
Yes. There are some zero maida
sourdough breads are available. We have only sourdough breads at home. So those breads are made out of they're not made out of wheat. So they don't give you that inflammation and gluten problem. And generally most of us have gluten intolerance.
Yeah. Any one case study which you would like to share of before after where maybe the skin was really dark or damaged or something, and how it just reversed?
So we have many such cases. In fact, we had one client in particular. I was really amazed to see the amazing difference on her skin. This client called Pratibha, a very elderly patient. She's in the 60s, early 60s. She came to me with black face. Everything else was brown, but this was black, absolute black. We changed her complete, diet, lifestyle. We included certain things. We changed her skincare, and she was so sweet to follow everything to the core. We always tell our patient it's going to be a partnership. It is never going to be just me doing things.
Yeah.
It is going to be 50% coming from you and 50% from me. So she did all that we asked her to do, and there was an amazing change that she saw. Amazing change.
So even at the age of 60, there is no age for your skincare because she did it at the age of 60.
So I think wellness is a mindset. My message to the viewers would be, it's how you lead your life is what matters. Okay, whatever number of years that you and I are going to live on this planet, we need to ensure that we lead a life which is going to be being, when you are healthy, you are happy. And nothing can replace your health. There are a lot of people who have died and gone who have said, oh, I wish I knew that health was more important than money. So they've made a lot of money, but unfortunately, they're not alive to enjoy that money today. So for me, health is definitely more important than anything else. I strongly believe in the fact that if you're healthy, your productivity is better, your confidence is better. You're able to do so many things at one go, at the whole day, which you were able to do when you were in your 20s, running around and doing everything. So I want to lead a life where I'm able to do the same thing till the time I live on this planet.
That's really wonderful, and thank you so much for for answering so many questions, for busting so many myths, and I'm sure that you would have got a lot of knowledge about how you should take your skincare journey. If you want to reach out to her, then I'll mention all the details in the description. You can check that and reach out to her. Thank you so much for watching our podcast.